The explosion shattered the morning calm at Children's Memorial Hospital as staff nurse Adriana Torres instinctively dropped to the floor, her body moving with trained precision that had nothing to do with pediatric nursing protocols. Around her, colleagues screamed and ran toward the exits while she assessed the blast pattern, smoke direction, and potential secondary threats with methodical analysis of someone who had survived similar attacks in 3 different war zones. The emergency alarm system wailed as wounded civilians began arriving at the hospital entrance, but what the panicking medical staff didn't know was that the quiet woman who bandaged scraped knees and administered vaccinations had once kept soldiers alive under mortar fire in places most people couldn't find on a map. Welcome to Those Who Left a Trace, where we uncover the extraordinary stories of people whose greatest battles remain hidden behind everyday uniforms. Before we dive into this incredible tale of courage under fire, tell us in the comments what city you're watching from today. And if you believe that some heroes earn their calling in the crucible of war, hit that subscribe button and join our community. The morning shift at Children's Memorial Hospital had begun like any other Tuesday in downtown Atlanta, with staff nurse Adriana Torres conducting her routine medication rounds through the Pediatric Intensive Care Unit. Her gentle manner with young patients and their frightened families had earned her a reputation as one of the most compassionate caregivers on the hospital's nursing staff. At 32 years old, she possessed 7 years of pediatric nursing experience that made her indispensable during the most challenging cases, when critically ill children required the kind of specialized care that separated exceptional nurses from merely competent ones. "Good morning, Mrs. Patterson," Adriana said softly as she entered room 314, where 8-year-old Timothy Patterson was recovering from emergency surgery to remove a brain tumor. "How did our brave patient sleep last night?" Timothy's mother managed a weak smile, despite the exhaustion that marked families maintaining bedside vigils. "He had a good night, thanks to you. That bedtime story you told him really helped him relax." Adriana checked Timothy's 4 lines and monitored his post-surgical recovery with the meticulous attention to detail that had characterized her nursing practice since graduating from Emory University's accelerated nursing program. Her movements were economical and precise, qualities that her colleagues attributed to excellent training and natural aptitude for medical care. "His vitals look excellent," she reported after completing her assessment. "Dr. Morrison should be making rounds within the hour, and I expect he'll be very pleased with Timothy's progress." What Mrs. Patterson didn't know was that Adriana's precise monitoring techniques and calm demeanor under pressure had been refined during 4 combat deployments, where she had treated casualties whose survival depended on split-second medical decisions made under enemy fire. Her transition from military service to civilian nursing had been seamless, though she rarely discussed her previous career with colleagues who assumed she had followed the traditional path from nursing school to hospital employment. Nurse Torres called Jennifer Walsh, the unit's charge nurse, as Adriana completed her rounds. "We got a new admission coming up from emergency. 6-year-old motorcycle accident victim with multiple trauma. ETA 5 minutes. Adriana nodded, already mentally preparing for the complex case management that pediatric trauma required. "I'll prep room 318 and coordinate with respiratory therapy for ventilator setup." Her response demonstrated the kind of immediate action orientation that marked nurses who thrived under pressure, though the speed and efficiency of her preparation suggested experience with trauma cases that went beyond typical hospital emergency scenarios. As Adriana prepared the trauma room, she moved with practiced precision that reflected thousands of hours managing medical emergencies under conditions far more challenging than anything a civilian hospital typically encountered. Her ability to anticipate equipment needs, coordinate multiple therapeutic interventions, and maintain calm focus during chaotic situations had made her invaluable during her military service as a combat medic with the 82nd Airborne Division. At 1,143 hours, everything changed. The explosion erupted from the hospital's main lobby with devastating force, shattering windows throughout the first 3 floors and sending smoke and debris through ventilation systems that carried the acrid smell of explosives to every corner of the building. The blast wave rattled medical equipment, triggered fire alarms, and sent patients, families, and medical staff into immediate panic. Adriana's response was instantaneous and markedly different from that of her civilian colleagues. While others froze or ran toward exits, she immediately assessed a tactical situation with trained efficiency that came from surviving similar attacks during deployments to Iraq and Afghanistan. IED blast, approximately 50 pounds of explosives, probably vehicle-borne based on the signature, she muttered to herself while moving toward the nearest window to assess external threats. Her analysis was automatic, based on experience that most people would never acquire. "Everyone stay calm," she called out to patients and families in the pediatric unit. "Move away from windows and remain in your rooms until we receive all clear from security." Jennifer Walsh stared at Adriana with confusion and growing concern. "How do you know it was an explosive device?" The fire alarm could indicate any number of emergencies. Adriana realized that her immediate tactical assessment had revealed knowledge that no pediatric nurse should possess. "I'm just being cautious. Let's focus on patient safety and wait for official information." The hospital's public address system crackled to life with an announcement that confirmed Adriana's worst fears. "Attention all hospital personnel. We have experienced an explosion in the main lobby. Security teams are responding to reports of armed individuals in the building. All units implement lockdown procedures immediately." As medical staff throughout the hospital struggled to process the reality of an active threat situation, Adriana's training kicked in with automatic responses that kept her alive during multiple combat deployments. She began conducting rapid threat assessments, identified offensive positions, and evaluating evacuation routes with a systematic approach as someone who had survived similar scenarios under hostile fire. "Jennifer, I need you to coordinate patient isolation procedures," Adriana directed with authority that surprised the charge nurse. "Move all ambulatory patients away from exterior walls and prepare to relocate ICU patients to interior rooms if necessary." "Adriana, you're talking like you've dealt with this kind of situation before." Before Adriana could deflect the observation, the sound of automatic weapons fire echoed to the hospital corridors, followed by screams and the distinctive crack of high-velocity rounds impacting concrete walls. "Active shooter," Adriana said grimly, her demeanor shifting from compassionate nurse to tactical professional. "We need to establish defensive positions and prepare for mass casualty treatment." Jennifer Walsh stared at her colleague with growing realization that the woman she had worked alongside for 2 years was responding to the crisis with expertise that went far beyond nursing training. "Adriana, who are you really?" The question was interrupted by the arrival of wounded civilians at the pediatric unit, casualties from the initial explosion who had been directed upward by emergency responders overwhelmed by the scale of the attack. A woman with severe lacerations stumbled through the unit entrance, followed by a man with obvious blast injuries and a child with trauma that required immediate medical intervention. Adriana's response was immediate and professional, her medical training taking precedence over the need to maintain her civilian identity. "Jennifer, establish triage in the family conference room. I'll handle immediate life-threatening injuries." She moved toward the most critically wounded patient with confident efficiency that demonstrated medical skills beyond typical nursing scope of practice. Her assessment was rapid and comprehensive, identifying injuries and prioritizing treatment with the kind of battlefield medical expertise that saved lives under the most challenging conditions. Penetrating abdominal wound, possible internal bleeding, signs of shock, she announced while applying direct pressure to control hemorrhaging. "I need 4 access, normal saline wide open, and someone to contact surgery immediately." Her treatment techniques were flawless, demonstrating knowledge of trauma medicine that exceeded what most emergency room nurses possessed. Jennifer Walsh watched in amazement as Adriana stabilized a patient using procedures that seemed more appropriate to military medicine than civilian nursing. "Adriana, where did you learn to do that?" Later, Adriana replied curtly, her attention focused on a second patient whose blast injuries required immediate intervention to prevent respiratory compromise. "Right now we have wounded people who need medical care. For the next 30 minutes, Adriana managed multiple trauma cases with expertise that gradually revealed the true scope of her medical training. Her ability to perform advanced life support procedures, manage complex injuries, and coordinate treatment under extreme stress demonstrated capabilities that went far beyond pediatric nursing. Patient stable, she reported after successfully treating a child with blast-related injuries that had initially appeared life-threatening. Wounds cleaned and dressed, vital signs stable, ready for transport to surgery when available. As the immediate medical crisis stabilized, the sound of approaching sirens indicated that law enforcement and emergency medical services were responding to the hospital attack. However, the continued sounds of gunfire from lower floors suggested that the threat was ongoing and that additional casualties would be arriving. "Adriana," Jennifer Walsh said quietly, "I need to know who you really are. What I just watched isn't normal nursing practice." Before Adriana could respond, the elevator doors opened to reveal two paramedics supporting a wounded security guard whose injuries required immediate treatment. Behind them, additional paramedics brought stretchers carrying victims of the ongoing attack. "We need medical assistance immediately," called paramedic supervisor Michael Chun, a veteran emergency responder with 15 years of experience. "Multiple GSWs, blast injuries, and we've got report of chemical exposure on the lower floors." Adriana approached the arriving casualties with professional calm that impressed the paramedics who had expected to find pediatric nurses overwhelmed by the scale of trauma they were encountering. "What's the tactical situation downstairs?" she asked Chun while beginning assessment of the wounded security guard. Chun paused, surprised by the question and the professional manner in which it was delivered. "How did you know to ask about tactical assessment?" "Just tell me what we're dealing with," Adriana replied while applying combat first aid techniques that stabilized the patient more effectively than anything Chun had observed from hospital nursing staff. 3 armed suspects, coordinated attack, possible chemical weapons deployment in the lower levels. SWAT teams are establishing perimeter and beginning clearing operations. Adriana processed the information with tactical understanding that revealed extensive experience with similar situations. ETA on medical evacuation for critical patients? 30 minutes minimum. The scene isn't secure enough for ambulance approach. Then we hold position and continue treatment here. Can you coordinate with Ensign Command to establish casualty collection point in this unit? Chin stared at Adriana with growing recognition that her responses were those of someone with extensive emergency management experience. "Ma'am, are you former military or law enforcement?" The direct question hung in the air as Jennifer Walsh, other nursing staff, and arriving paramedics waited for an answer that would explain the extraordinary medical and tactical capabilities they had been observing. "Paramedic Chun," Adriana said quietly, "right now we have wounded people who need immediate medical care. Personal background can wait until everyone is stable." "Roger that," Chun replied, unconsciously using military terminology that suggested he recognized something familiar in Adriana's bearing and competence. For the next hour, Adriana managed a makeshift trauma center in the pediatric unit, treating wounds that ranged from blast injuries to gunshot trauma with expertise that exceeded the capabilities of most emergency room physicians. Her ability to perform advanced medical procedures, coordinate multiple treatment priorities, and maintain calm leadership during the crisis demonstrated training that could only have been acquired through extensive military medical experience. "Patient stable for transport," she announced after successfully treating a police officer with multiple gunshot wounds whose survival had depended on immediate intervention that prevented exsanguination. "Bleeding controlled, airway secure, ready for evacuation when tactical situation permits." Paramedic Chin observed Adriana's medical techniques with professional admiration that gradually transformed into recognition capabilities he had only seen from military combat medics. "Ma'am, I need to ask again, what's your medical background?" "What I'm observing is field surgical technique that goes far beyond nursing training." Adriana looked around the improvised trauma center she had established, noting that immediate medical needs had been addressed and that arriving law enforcement personnel were indicating that the tactical threat was being contained. Paramedic Chun. My name is Staff Sergeant Adriana Torres, former combat medic with the 82nd Airborne Division. I have 4 combat deployments and approximately 1,200 hours of trauma medicine experience under fire. The revelation sent shockwaves through the assembled medical personnel, who had spent hours watching her demonstrate capabilities that now made perfect sense within the context of military medical training. Staff Sergeant Jennifer Walsh repeated in amazement, "You're active duty military?" Former military, Adriana corrected. "I completed my service 3 years ago and transitioned to civilian nursing through the Veterans Administration Educational Program." Paramedics studied Adriana with new understanding of the exceptional medical performance he had witnessed. How many combat medical deployments? For tours, 2 in Afghanistan, 2 in Iraq. Assigned to forward operating bases, where I provided medical support for infantry and special operations units. Combat casualty experience? Adriana considered the question, understanding that her answer would provide context for the medical techniques that had saved lives during the hospital attack. Approximately 400 combat casualties treated under fire, ranging from routine injuries to mass casualty events. Survival rate of 97.3% for patients who reached my aid station alive. The statistics were staggering, representing medical experience that few civilian practitioners would ever encounter. Chun realized that Adriana's performance during the hospital crisis had been informed by training and experience that prepared medics to save lives under the most extreme conditions. Staff Sergeant Torres, Chun said with obvious respect, "What you accomplished here today probably saved a dozen lives. Your triage decisions, medical procedures, and crisis management were exceptional. Thank you, Paramedic Chun. Just applied the training I received and did what needed to be done." As law enforcement completed their clearing operations and declared the hospital secure, word of Adriana's role in managing the medical emergency began spreading among first responders and hospital personnel. Her ability to establish effective trauma treatment under attack conditions had prevented what could have been catastrophic loss of life. Adriana, Dr. Elizabeth Morrison, the hospital's chief of emergency medicine, approached with questions about the medical procedures that had been performed during the crisis. "I need to understand how you were able to manage such complex trauma cases. Some of the techniques you used are beyond the scope of nursing practice." Dr. Morrison, "I used medical training acquired during military service. All procedures were performed within my scope of competence based on combat medical experience. What specific training and certification do you possess?" Adriana provided a summary of her military medical qualifications that included advanced trauma life support, field surgical procedures, and mass casualty management techniques that exceeded most civilian emergency medicine training. Staff Sergeant Torres, would you consider transitioning to our emergency department? Your capabilities are precisely what we need for trauma medicine. Thank you, Dr. Morrison, but I prefer pediatric nursing. Children need specialized care that adults can provide for themselves. As the hospital began returning to normal operations, news media arrived to report on the terrorist attack and the medical response that had prevented greater casualties. Adriana found herself reluctantly answering questions about her role in treating the wounded during the crisis. Nurse Torres, witnesses report that you managed trauma cases with unusual expertise during the attack. Can you comment on your background? I use medical training available to me to treat wounded people. That's what any healthcare provider would do in similar circumstances. But several paramedics have described your techniques as military-level medical care. What's your response to that assessment? Adriana realized that her carefully maintained civilian identity was ending, just as it had for other veterans whose military experience became apparent during crisis situations. I serve as a combat medic with the 82nd Airborne Division before transitioning to civilian nursing. Today I applied that training to help people who needed medical care. The revelation generated immediate interest from news outlets that began investigating her military service and the circumstances that had brought a decorated combat veteran to work as a pediatric nurse. Staff Sergeant Torres, military records indicate that you received multiple commendations for medical service under fire. Can you discuss your combat experience? My military service is a matter of public record. Today's focus should be on the victims of this attack and the first responders who protected this hospital. As media attention intensified, Adriana received an unexpected phone call that would change her civilian nursing career once again. Staff Sergeant Torres, this is Colonel Patricia Williams, Army Medical Command. I've been following news reports of your actions during today's crisis. Yes, ma'am. Staff Sergeant, the Army is interested in discussing your potential return to active duty. Your performance today demonstrates capabilities that we need in our combat medical program. Adriana considered the offer while looking around the pediatric unit, where she had spent 2 years caring for critically ill children whose medical needs had nothing to do with combat trauma. Colonel, I appreciate the offer, but I'm committed to civilian nursing. These children need specialized care that I'm qualified to provide. I understand your position, Staff Sergeant. However, I'd like to discuss consultation opportunities that would allow you to contribute to military medical training while maintaining your civilian career. What type of consultation, ma'am? Training programs for combat medics who are transitioning to civilian health care. Your experience bridging military and civilian medicine makes you uniquely qualified to help veterans make that transition successfully. The offer represented an opportunity to use her complete experience in ways that could benefit both military personnel and civilian patients who needed trauma care capabilities. Colonel, I would be interested in discussing consultation that supports veteran transition while allowing me to continue pediatric nursing. 3 months later, Adriana had established a training program that taught combat medical techniques to civilian emergency responders while helping military medics transition to civilian healthcare careers. Her experience during the hospital attack had demonstrated the value of military medical training in civilian emergency scenarios. Staff Sergeant Torres, said Fire Chief Robert Hayes during one of her training sessions, the techniques you're teaching have already improved our response to trauma calls. This cross-training between military and civilian medicine is invaluable. Chief Hayes, combat medicine, and civilian emergency care share fundamental principles. When we combine the best of both approaches, everyone benefits. As Adriana continued her work in pediatric nursing while contributing to emergency medical training, she carried with her the knowledge that her military experience had value beyond personal achievement. Her actions during the hospital crisis had saved lives and created opportunities to improve medical care for both military personnel and civilian patients. The terrorist attack at Children's Memorial Hospital became a case study in effective crisis medical response, with Adriana's role highlighting the capabilities that military veterans brought to civilian health care. For the patients and families she had protected during the attack, she would always be remembered as a pediatric nurse who became a warrior when circumstances demanded it. And for Adriana Torres, the revelation of her combat medical background marked not the end of her civilian nursing career, but the beginning of a new phase where her complete experience could be used to benefit others who share the challenges of providing medical care under the most demanding conditions.